Welcome back. With so many rules changing at once, here's a guide of what you can and can't do around the country. Step 2 began today, which enables people in England to gather in groups of up to 6 people at once. That must be outdoors, including gardens. And social distancing rules will still apply, so different households must remain at least 2 metres apart at all times. On June the 15th, all other non-essential retail could reopen on the condition that they are following government guidelines. Step 3, which is scheduled to begin around July the 4th, includes the reopening of hairdressers and beauty salons, hospitality companies such as pubs and hotels, public places like places of worship, and leisure facilities like cinemas. Scotland has a different route map. Phase 1 opened last Friday with up to 8 people allowed to meet outdoors across 2 households. Sunbathing is allowed, along with some outdoor activities like golf and fishing. Garden centres and drive-through takeaways can reopen and childminding services can begin. Schools will not return until the 11th of August. In Wales, outdoor gatherings of 2 households will be allowed from today. There's no limit on the number of people allowed to meet, but they will need to stay within 5 miles of their home. While Northern Ireland plans to enter the second phase of lifting its lockdown a week today, groups of 6 people who do not share a household are already allowed to meet outdoors. I'm joined now by one of ITV News' political correspondents, Carl Dinnan, who'll try to take us through the latest government guidelines. Welcome to Coronavirus
Lovely
Q&A.
to be here.
Lots to get through. Let's start with a question from Laura about scammers. She says, how will we know whether the contact from the NHS test and trace system is genuine?
This is a really good question, really important one, because people have to have faith in this. So if somebody from NHS Test and Trace gets in touch with you, it's because you've been in close contact with someone else who's tested positive for coronavirus. But the tracer won't be able to tell you, because of patient confidentiality, who that is. So it might seem a bit odd. The best thing you can do is check how they've got in touch. So check whether it's the right phone number. In England, it's a phone number ending 5000. We'll stick it on our website. Or whether it's from the text message, the number that you expect it to be from. You can check this for Scotland, Wales, and Northern Ireland as well. They'll all be a little bit different. The next thing they'll ask you to do is either log into the website to give you further instructions, or they'll talk you through those if you can't do that. But most important of all is remember never to give out any bank details or passwords to anyone who calls you saying they're from NHS Test and Trace.
If you're being asked for that, it's not the NHS. OK, Rosie says, I'm returning from teaching abroad on the 19th of June. I will be living with my parents and younger brother. She says they're not at high risk. How much will they need to isolate too?
The good news for Rosie's family is that they don't have to at all. So Rosie will, coming back from wherever she is, have to self-isolate. As of Monday, anyone coming into the UK from abroad, apart from a very few key workers, will have to self-isolate for 14 days. But so long as it's in a private residence, nobody else there, unless they have symptoms, of course, has to self-isolate.
OK, Sue asks, with the opening of clothes and shoe shops, how safe will it really be? She points out, what about all the items hanging and on shelves that hundreds of customers will handle, cough and sneeze on all day?
This is a really interesting one. Now, shops in England, retail, non-essential retail, like clothes shops, we're expecting to open around about the 15th of June. For the other nations, that may be later. Changing rooms will probably be closed. It's going to be a very different experience. So if you do want to try something on, you're probably going to have to buy it, take it home, and then when you send it back to the shop, if you don't want it, they will probably quarantine that for around 72 hours. For stuff in the shops, customers will be discouraged from touching anything, and you will probably be encouraged to use hand gel on your way in and out of the shop.
OK, Sarah wants to know, when will members of the public who do not drive be able to travel legally and safely on public transport for leisure?
Well, actually, it's not illegal to go on public transport for leisure now, but it goes against a couple of key bits of guidance. One is you're only supposed to be travelling on public transport if it's for essential travel. And even then, the government would rather you found another way of travelling. And we simply don't know, is the answer to the question, when that guidance will be changed. If you are in public transport, though, they'd like you to use a face mask, and they're a bit worried that not many people are.
Interesting. Let's squeeze a quick one in from Bernard. He wants to know when vets will be allowed to open for general surgery, such as neutering. He's worried about an outbreak of unwanted puppies and kittens. You've got about 10 seconds.
Very briefly, at the beginning of the lockdown, for the first 3 weeks, you couldn't do this, but now vets are allowed for welfare reasons to do surgery for animals. Check with your vet.
Great news, Carl, for now. Thank you very much. And Carl will join me in a few minutes, along with Dr. Sarah Jarvis, for many more of your questions online. Before we go, though, a love story with a difference. The couple forced to move in together before lockdown. How did they cope? And what did it lead to? Take a look.
Hi, I'm Miriam. I live in London, and I'm just about to launch my new business, CBD Angel.
Hi, my name is Gabriel. I'm from Brazil. I live in London about 3 years now.
So I'd say at the beginning, the strangest situation to be like locked down with like another human being, literally being with someone for like 24 hours a day.
I need my space now, no, but
I think we just took the time to understand each other more, and we just like that now. Like, to be honest, if one of us goes out, we kind of miss each other. The CBD Angel business was my idea that I've had for a while, but I just didn't have the time to really execute it. So I thought, right, this is my chance. If I'm going to do it, I'm going to do it now. And then I realised, I actually got to know Gabriel a bit more. So I realised, he's really good at these things. So he could be amazing in the business. It was the foundation to our whole future and our lives and our future family and our businesses, and that time period gave us the time to really cement our future. And yeah, when you have a moment to just breathe and have space and sit down, you really understand what you want. So I think we both this is really, really what we want. Let's just do it.
Keep calm, guys. Work together. Yeah, I think that's it.
Good luck to them. Thanks for your questions. We'll get more answers next Monday at 8. Enjoy the rest of your evening. Goodbye. Welcome to Coronavirus Q&A online tonight with Dr. Sarah Jarvis and Carl Dinnan. Sarah, if I can pick up and start with you, we've got a question in from Siobhan who says, it is impossible to get children to social distance with family members. Does this mean we will have to wait to be allowed to hug and kiss again? Siobhan has a newborn and a 2-year-old.
I'm really sorry, Siobhan. The regulations are really pretty clear. The problem is that if they do hug and kiss, then what's going to happen is they're going to transfer the risk of your household onto their household. If one of them's going to nursery, or if any of the rest of you are at higher risk, that does mean increasing the risk to grandma and grandpa. So I know it's really tough. I don't know whether maybe if the older ones at nursery, you could see the newborn but not hug them, because at least they won't try and scramble over to you. But the rest of it, the hugging, I'm afraid, is going to have to wait.
You say the rules are very clear about that. Do you think the rules are clear about, for example, the fact that from today people are allowed to have barbecues? There are kind of strict guidelines about bring your own chair, bring your own cutlery, sometimes bring your own food. Do you think that message is getting out to everybody?
What worries me slightly is that the message is slightly different in every household. So in England and Northern Ireland, you can have up to 6 people. In Scotland, you can have up to 8 people, but only from 2 separate households. And in Wales, you can have 2 households as big as you want them to be. There can be an unlimited number of people, but it's only from 2 households. And then in Scotland, they've specified that people should be bringing their own crockery, their own cutlery everything and their own food to a barbecue, whereas in England, Wales and Northern Ireland, that's not clear. So no, I think it is difficult. Basically, to be on the safe side, what you should be doing is making sure that you don't touch tongs or equipment or serving dishes that anybody else has touched, and that if you are going to use plates and cutlery from other people, that you wash them down beforehand. And of course, really importantly, although you can go into the house to go to the loo, it is only to go to the loo or to get through the house into the garden. No other going into the house, and please social distancing, which probably means no alcohol, because we all know what happens to inhibitions when a few drinks have been consumed.
Yeah, Carl mentioned a concern just a minute ago about the lack of people wearing masks. Does that concern you, especially when we know now that that should protect other people if we have got the virus?
Yeah, so it is an altruistic act. It doesn't protect you. And what worries me is that still when I go out, it seems to me the only people who are wearing masks are the ones who want to use them because they think that it means they can invade my personal space and lean over me or walk straight up to me. So if you are in an enclosed space where you can't socially distance, by which we're saying public transport in all three of the four countries who've got it, Wales doesn't have masks yet, or public transport and enclosed shops, spaces such as shops in England and Scotland, the recommendation is that you should consider wearing a mask. It's not being enforced in any of them. We do know that it reduces the risk of passing the virus on, but outside in the open air, there is no evidence of benefit from masks.
Okay, a question from Paula. She wants to know when doctors' surgeries will reopen for normal appointments.
So doctor surgeries are probably going to be staying with their doors closed for quite some considerable time. However, that does not mean you cannot go in. What will almost certainly happen going forward, and I think probably for quite some time going forward, because of the risk, not just to doctors and nurses and receptionists, but also of the risk to patients if they're poorly, is that we will want to triage people. That'll mean a telephone or video consultation first. And then if they think that you do need to go in, having checked that you don't have symptoms of coronavirus, you can go in. If they think you've got symptoms of coronavirus, either they will direct you elsewhere and possibly come and see you at home if you do need to be seen, or you'll be directed to a, quote, hot hub. Otherwise, people will go into a cold hub. It does mean you can continue to be seen, and we certainly want people to go in if they have serious conditions or if they need follow-up for things like high blood pressure, diabetes, other regular medications they're taking.
Okay, Trish has a question for you now about people that don't have symptoms. Let's have a listen.
Hi there. My question is about people who are asymptomatic. If and when they get tested for COVID-19, how long are they infectious for? Is it weeks, or can they be carriers for months?
What's your answer for Trish?
So really good question, Trish, and we do worry a lot about carriers. But the tests that have been done so far suggest that it's got a relatively narrow window. The problem with coronavirus is that even with people who do develop symptoms, they can be infectious for 2, possibly 3 days before they develop symptoms. However, it's fairly clear that if you've got the virus, then you'll be infectious from about 2 to 3 days before you develop symptoms until about a week after. People with more severe illness are more likely to be infectious for longer. So people who are asymptomatic may actually be less infectious than people who've got symptoms, and they're certainly not likely to be infectious for more than about that 9-10 day period.
Okay, what are you advising your patients, Dr. Sarah Jarvis, about people who want the antibody test? There's a bit of confusion about whether that's readily available, whether you should buy it privately. What's the situation with that? Because obviously people are wanting to know if they have had it over the past few weeks and months.
Of course they are. So very important to know that there are now antibody tests which have been approved by Public Health England, but they have to be the right tests. Currently there are just 2 by Abbott and Roche. They have to be the right test. They have to be processed in the right laboratory. A test which says it'll give you the answer on the spot or within 20 minutes should never be used because they're not reliable. And importantly, it has to be done by the test. The bleeding has to be done by a healthcare professional. So it could be a finger prick test or it could be a venous blood sample. But either way, the test yourself at home has not been validated, therefore shouldn't be used. Those ones are very accurate in terms of having at least the 99% what's called specificity if they're tested about 2 weeks to 3 weeks after you develop symptoms. However, again, importantly, it doesn't say that you're immune. What it says is you've got antibodies. We don't know for certain that gives you immunity, although there's a reasonable chance it does. And even if we do discover that it gives you immunity, we don't know how long that immunity will last for. Now, at the moment, we're just rolling out the testing. There is a lot of capacity in terms of tests and laboratories, but not that much capacity in terms of staff to take the tests. So if you're having a blood test for another reason, you can ask for an antibody test, and they may well be prioritising in GP surgery. Certainly we're looking at people at highest risk. So for instance, people in care homes, people who are shielding, people who've got long-term conditions, maybe people with a BAME origin, people with diabetes, people who are very markedly overweight, because those are the ones who are most at risk if they do get it. And it will give us an idea of how many people have been affected and which pockets they've been. But again, that caveat that we don't know for certain. If you're not in one of those groups, your GP may not want to give it to you now because there is a limit on the number of people to take the tests. You can absolutely get it done privately. For instance, on patient access, you can order it with those 3 criteria. Don't forget, it must be the right antibody test, done at the right laboratory, and using a finger prick or blood test taken by a healthcare professional.
Super clear. Thank you for that, Sarah. On the easing of lockdown, Chanel wants to know, if the lockdown is getting lifted, why are pregnant women still attending appointments alone and giving birth alone?
It's a very good question. Unfortunately, the restrictions do seem to have moved fairly quickly, but what we need to bear in mind is that, of course, an area where it's incredibly important to reduce the risk, in the same way that I answered earlier on about GP surgeries, it's really important to try and reduce the risk of infection spreading through a maternity ward. So I do hope that as the cases continue to drop, that hospitals will feel able to introduce the ability for partners to go with you to your antenatal appointment and perhaps to come and visit you after you've had your baby. But it's really just a question of, this is a very vulnerable area. We've got mums obviously with newborn babies, with other children running around. The other children often can't socially distance, so we don't want the risk to be higher than it has to be.
Okay, thank you. I'll come back to you in just a sec. Let me bring Carl in now with a question from Lisa. She wants to know, picking up on talking about public transport earlier, what happened to all the talk about bringing forward by June e-scooters being made legal so we don't have to use public transport? Lisa says it was mentioned on a daily briefing, but there's been no mention of that since.
Yeah, Lisa's right. It was mentioned. The government have said about 3 weeks ago, I think it was, that they would fast track the trials on e-scooters. As part of that, some people may start to see some e-scooters later this month, but there'll be rental scheme ones. Private e-scooters still aren't legal. And I'm afraid the answer for Lisa is that until the regulations have been written around design standards and minimum ages, e-scooters will continue to be illegal. And we just don't know how long that will take. So for Lisa, I think at the moment, if she can get hold of one, a bicycle is probably a better option.
Okay, Carol has a question about who comes into your house. She says, I'm a social housing tenant and I've been informed that a gas engineer will be calling at my property to carry out the yearly gas service. Can I refuse this? Why should I allow workmen into my property when I'm not allowed to have a family member visit?
This depends a little bit on Carol's circumstances and whether anybody in the house is clinically vulnerable or self-isolating or shielding. If that's the case, call the landlord and get it delayed. Beyond that, the government is actually encouraging gas inspections to go ahead for obvious safety reasons, and because people are spending more time, if anything, of course, at home at the moment. So the government would rather you did have the gas tested if there's not any other reason for somebody not to come into your house. If you do have somebody, a work person of any sort, into your house, then all the normal hygiene and social distancing rules apply. You know, keep your distance, clean surfaces afterwards, all that kind of thing.
Okay, let's just bring Sarah in on that point then. If you are shielding, Sarah, and you've got one of those kind of essential checks being needed in your house, I think I've asked you this before, but just to clarify, can you let somebody in to do essential work on your house?
Well, the ideal, of course, is that you don't let anybody into your house, even now that you are allowed out if you're shielding, or at least, of course, the announcement hasn't yet been made in Scotland, but in England and Wales you can. However, I would say that in an ideal world, if you live with somebody else, you shut yourself away in a completely different part of the house and make sure that you are not in contact with them, because they will be indoors, so the risk of infection is higher. If you absolutely cannot avoid letting them in, then they would have to come in, even if you lived alone. But in an ideal world, again, you would make absolutely certain you'd check who they were first through the window, obviously very important to have the right precautions. Then perhaps you would put the door on the latch, go away into another room, and then allow them to do their work. But again, in an ideal world, of course, we don't want people who are vulnerable to be vulnerable to scammers.
Yep, indeed. Something else to think about. Carl, Kate wants to know about a holiday that she's got booked. She's going to Portugal, or was planning to go to Portugal on the 28th of June. She says she's a type 1 diabetic, so she doesn't want to go because of the risks. The current guidelines give an indefinite date for travel restrictions. What are her options?
Well, if she doesn't want to go because of the risk, she shouldn't go. In any event, actually, at the moment, the government advises against all but essential travel abroad. June the 28th, I mean, that might have changed by then. We simply don't know. But if she is worried about going, then she should get in touch with her travel company. Because the government isn't allowing anything but essential travel, she should be in quite a good position to negotiate either a different date or possibly a refund. But so I know some travel companies are having difficulties processing all the applications because so many people are changing their summer plans. So I would say she might be better getting in touch with them sooner rather than later.
Okay, a final one for you. The person doesn't give their name, but she or he wants to know, now that lockdown is easing, am I able to stay at my second home in Cornwall?
A very short answer is no, although if you are worried, as this person might be, about whether the property is safe, for example, you can travel. If you're within England, you can travel for exercise or leisure purposes, so long as you don't stay in the place that you've travelled to. So if it is possible to get there and back in a day, in theory, yes, you can go check the place, but you must come home. You're not allowed to stay in a second home.
Okay, Carl, thank you very much. Let's end with Sarah. Lindsay has a question about her relationship. Let's have a listen.
I haven't seen my partner since the beginning of lockdown. He got COVID-19 in April. He lives a 3-hour drive away from me. When will he be able to stay over?
Can you help Lindsay there with any sense of when that might be able to happen?
Sadly, Lindsay, I do have to tell you that at the moment he is not allowed to stay over. And theoretically, if you think about it, actually, you could be prosecuted for staying over because you're not allowed to go into somebody else's home except to go through it or to visit their loo. However, we do know that the regulations are easing gradually. We know that, of course, the two of you can now meet up, which you couldn't do until very recently. So I know he's 3 hours away, but maybe if you made kind of a big day of it, you could have at least a goodly few hours between you. I'm afraid it's likely to be at least another couple of months. And my personal feeling is that's all going to be dependent on what happens to the number of cases. So it's all dependent on all of us doing the right thing and continuing to practice social distancing till then.
A good message to end on, Dr. Sarah Jarvis. Thank you, Caldin, and thank you for joining us here on Coronavirus Q&A Online. See you next Monday at 8:30. Bye-bye.